Welcome everyone. My name is Sierra Butterfield. We're happy to have you here on our webinar today. HIPAA compliance, privacy, and right of access is what we'll be discussing. If you have any questions that you would like us to address, just chat them into the question box and we'll answer them at the end. The webinar itself will take about 30 minutes and then we'll leave a few minutes at the end for that Q&A. So with that, I'd like to introduce our speakers and the topic for today. So Toby Morrison joined Enterprise Health on August 2022 and has been a sales leader for over 20 years. Prior to joining Enterprise, he was with Dr. First, where he worked with an independent physician groups on e-prescribing, telehealth, and medication management solution. We also have Courtney Morgan with us. She has over 20 years of experience working in the hospital and healthcare industry and has been a HIPAA compliance officer for over 10 years. She is passionate about being an experienced HIPAA auditor, specializing in privacy, security, breach notification regulations, and helping clients stay HIPAA compliant. So with that introduction, I'd like to turn it over to Toby to kick off our webinar on privacy compliance.
Thanks, Sarah. So a little bit of background on Enterprise Health. We are a healthcare-focused cybersecurity company dedicated to solving key challenges affecting our industry. So our team of seasoned experts provide advisory, planning, readiness, and assessment services through a combination of services and software. And our software products include HIPAA 1, NIST CSF Secure Maturity Manager, Blueprint IRM, and TPRM. So with that, I'd like to talk a little bit about our agenda today. So first, we're going to talk a little bit about HIPAA privacy and right of access, specifically touching on why so many organizations are being fined. Then we'll talk about potential changes for 23 and touch a little bit on state laws as well. Okay, sorry about that. So Courtney, talk to us about some of the most common privacy complaints.
Yeah, thanks for sharing that. So of the 5 most common alleged complaints, they are impermissible uses and disclosures of protected health information, lack of safeguards of protected health information, lack of administrative safeguards of electronic protected health information, the use or disclosure of more than the minimum necessary, and then the lack of patient access to their protected health information. And as you can see, the lack of patient access is among the top 5 of the complaints that are submitted to HHS, and that has not been in the case in the past, and so it's kind of interesting to see that crawl up the complaint list. Toby, would you like to expand on the lack of patient access to their protected health information and what that means?
Sure. So the OCR has been really on top of this. Just this past year, there were 43 right of access cases that were settled, and the penalties range, it was pretty great, right? They range from $3,500 all the way up to $240,000. And it was really organizations of all types and sizes, everything from surgical centers to psychiatry offices, to health plans, and even small provider and physician practices. But I think the most telling thing is the quote from our new OCR director, Melanie Fontes-Renier, who said that they are very serious about upholding the law, people's fundamental right to timely access to medical records, and they're not concerned about how large or small the organization is. But I think the question that's probably in everybody's mind, Courtney, is what exactly is right of access? What does that mean?
Well, that is a great question. So what is right of access? So the privacy rule generally requires HIPAA-covered entities like health plans and most healthcare providers to provide individuals upon request with access to their protected health information about them. Whatever is in what they call as a designated record set maintained by or for the covered entity. What is another important factor is what is considered protected health information. So protected health information includes all individually identifiable health information, and this includes demographic data, medical histories, test results, insurance information, and any other information used to identify a patient or provide healthcare services or healthcare coverage. So the patient right of access also includes like the right for them to be able to inspect or obtain a copy of their personal health data, their protected health data information, as well as direct the covered entity to transmit a copy of the designated person or direct the covered entity to transmit a copy to a designated person or entity of the individual's choice. Individuals also have a right of access to this data for as long as the information is maintained by the covered entity or by a business associate on behalf of the covered entity. And this is regardless of the date the information was created, whether the information is maintained in paper or electronic systems, whether it's on site or remotely, or even if it is archived. Where the PHI even originated. It's also important to be able to provide this information in a timely fashion. So HIPAA federal regulations states no later than 30 calendar days, but it's encouraged to respond to the request as soon as possible. This does also vary depending on state regulations, because there are some state regulations that are more stringent than the HIPAA federal regulations. There is some information that is excluded from the patient right of access, and that kind of exclusions includes stuff like psychotherapy notes and information compiled in reasonable anticipation or for use in a civil, criminal, or administrative action or proceeding. And please remember, so in 2016, the 21st Century Cares Act made sharing electronic health information the expected norm of healthcare by authorizing the Secretary of Health and Human Services to identify reasonable and necessary activities that do not constitute information blocking. So it's important to also know what other regulations may interfere or support the HIPAA regulations and such. And let's move on. So let's think of some tips to avoid non-compliance. So some tips to avoid non-compliance are listed here. Non-compliance can lead to business disruption, productivity losses, fines and penalties, along with settlement costs. And that includes like legal defenses and corrective action plans. So they can become quite costly. Organizations that have proactive approaches to HIPAA compliance will significantly reduce the compliance gaps and potential complaints, violations, breaches, and even possible audits. So as you can see, safeguards is pretty important. They should be sufficient to the organization type and size and what the organization's goals are. Sufficient safeguards play a very important role in protecting the data. And this includes making sure, good encryption, access control, and everything is in place that is sufficient for your organization type and needs. Policies and procedures, this is another big one. They should be transparent and available to those who need them to perform their duties. These standards show the organization's intent, and it provides guidance to the workforce to follow the compliant processes put in place for them. Here you also see training. Training should cover the organization's policies and procedures, the HIPAA rules and regulations, including like sanctions, accountability. Training is also a very important part of protecting data, as many violations and breaches occur due to workforce actions, the staff actions and stuff. So it's very important that they're trained to, know exactly what is acceptable or not acceptable actions that they do in their everyday lives. Sometimes they get comfortable and they forget. So it's important to, keep that reminder on them, understanding what PHI is and how it can be used and disclosed and meet HIPAA compliance and such. Documentation is also very important. So your organization want to document all of the HIPAA related efforts. They should be maintained. It shows due diligence in your efforts, and it will come in handy and know, your guys' roadmap to see how far you guys have come. HIPAA risk assessment should be conducted. These are very important to identify any gaps. These allows for a creation of a roadmap to address these gaps, identifies any weak points or anything that you guys can work on. It's very important to do these so that your organization is aware of your privacy profile. Another important thing is due diligence. Perform due diligence on the business associates that covered entities work with, because covered entities are accountable for their business associates. So it's important to have the due diligence of the business associates conducted and business associate agreements reviewed, revised as needed, and that is managed very well. And I would really like to point out another really good tip to avoid noncompliance is analyze the latest breaches and learn from others' mistakes. Right here, as you can see, Warren Buffett says it's good to learn from your mistakes. It's even better to learn from other people's mistakes. And I think that it really pulls true to breaches and violations and such at this time. So there's plenty of places that you guys can get access to this. The OCR has an email subscription that you can subscribe to, and it sends email notices and information on occurring breaches in the industry and such. And so that's a really good resource. So Toby,
so Courtney, that's fantastic. There's one of the things that people were most interested in. We're understanding some potential changes in guidance and rules. Could you give us some insights onto those?
Yeah, so let's move forward. So the HIPAA Privacy Rule proposed changes. So it's a little bit hard to say what to be ready for and such, because due to the extent of the proposed HIPAA changes and their potential impact, the deadline for submitting comments was extended to May 6th of 2021 because there was so much, as you can see in the timeline. However, the OCR has yet to provide a date for when the final rule will be issued. However, changes are looking to be done in changes to HIPAA is looking at 2023, but are likely not to be implemented until 2024 for those changes to become enforceable. So it gives you a little bit of time, but you just want to make sure you're watching and be prepared for that. The proposed changes to the HIPAA Privacy Rule is really to support individuals' engagement in their care, remove barriers to coordinate care, and reduce regulatory burdens on the healthcare industry. So December 10th of 2020, the proposed changes included strengthening the individual's rights to access their own health information, and this is including electronic form information. Improving information sharing for care coordination and case management for individuals, facilitating greater family and caregiver involvement in the care of the individuals experiencing emergencies or other health crises, and enhancing flexibilities for disclosures in emergency or threatening circumstances, such as the opioid crisis or COVID-19 public health emergencies, and reducing the administrative burdens on the HIPAA covered industry and healthcare providers' health plans, while continuing to protect the individual's privacy rights and interests. So the proposed HIPAA rule changes, they are far-reaching and affect almost everyone that interacts with the healthcare system. Some of the challenges that, the main challenges that are being seen is the burden of the changes. The proposed changes, the cause of concern for many covered entities and business associates and patient privacy advocates is due to the potential impact they will have on the privacy and security of healthcare data and the administrative and economic burden the changes may place on healthcare providers. So while some of the proposed changes to the HIPAA Privacy Rule are intended to ease the administrative burden on the healthcare organizations, when the final rule is published, considerable time and effort will be needed to put into implementing the changes. There will be need to update the policies and procedures and communicate those changes to patients and health plan members. Employees will need to be given further training, and HIPAA Privacy Rule training should be provided wherever there is material changes to the HIPAA policies. So there is going to be a lot of burden in the front of it, but as I mentioned, it's supposed to be able to reduce some of the burdens in the long run. Some of the conflicts and concerns that have been noted. So one of the proposed changes has attracted some criticism is the requirement to make the sharing of EPHI with other providers mandatory. So this really caused some concerns. So both the American Hospital Association and the American Medical Association have voiced their concern about the mandatory sharing of healthcare data. And they have also expressed some concern about the change in the shortened timescale for responding to patient requests for copies of their medical records. So in the past, in current, it's 30 days, and they want to change it to 15 days, which causes a lot of concern with the healthcare providers current extensive needs and where they need to apply the resources. Substance use, another concern is substance use disorder records. They are treated differently than other types of PHI, and that may cause potential conflicts between the proposed new HIPAA regulations, the 42 CFR Part 2 regulations that are relating to the confidentiality of substance use disorder patient records, and the Cures Act regulations. So it could be some time until any new HIPAA regulations actually are finalized. And of course, you can find the proposed new HIPAA regulations announced by the OCR on the OCR website and many other resources. And there's no date, as I was saying, there's no date set for when these will be taking into effect. But again, there are plenty of resources that you can find more information and you can reach out to our team. So I'm going to pass it back over to Toby.
Thank you, Courtney. So obviously that's kind of a look at the federal level, but there's several states where the individual state laws do supersede federal privacy laws. So can you talk to us a little bit about some of the examples at the state level that we should be noting?
Yeah, of course. So there are some state-specific regulations that supersede HIPAA laws, and some of those state stringent are, you know, California, Colorado, Idaho, Maryland, and Washington. Another important factor, though, outside of the protected health information regulations covered by HIPAA, many of our states' governance bodies have identified that further protection to the privacy of individuals and their personal data is needed. And some have passed state regulations to expand privacy laws to protect individuals' personal data. And this includes their personally identifiable information. So some of them leaning on similar regulations to GDPR. So a few of the state-specific laws, more states are adding new laws all the time, setting a precedence and protecting their residents' rights. So privacy laws, some of them have already put into effect, and as you can see right here, so California Privacy Rights Act, that went into effect just this month. And this actually replaced the previous California CCPA law. It just extended on it, and so they just replaced it with the CPRA. So they expanded it on it and replaced it, and it went into effect this month. Another one that went into effect this month is Virginia Consumer Data Privacy Act. So this expands further than just HIPAA and the protected health information. You know, states have noticed that there's a greater need to protect that data. And as you can also see, Colorado Privacy Act, this will be put into effect just July of this year as well. So it's really important to be aware of these state-specific privacy laws as well as the state stringent privacy laws that supersede HIPAA, and so that you guys are taking care of the organization's overall needs and such.
So Courtney, can you talk to us a little bit about what the breach notification rule is?
Yeah, so the breach notification rule includes guidelines to which covered entities must notify when a breach occurs. So there has to be a notification to the individuals with specific content about the breach to the affected of the breach without reasonable delay and in no later than 60 calendar days. So it's really important for notifications to the individuals to be notified as soon as possible. Notification to the media. So if breaches involve more than 500 residents in an area, they need to notify prominent media outlets serving the state or jurisdiction also no later than 60 calendar days. Notification to the Secretary of Health and Human Services. So if breaches involve more than 500 residents, again, no later than 60 days after the discovery of the breach. If it's less than 500 residents, no later than 60 days after the end of each calendar year. So notifications by a business associate to a covered entity, so without reasonable delay. So, and in no case later than 60 calendar days, because it's really important for the covered entities to know, what needs to happen with the notifications when the breach does happen from one of their business associates. The And again, some state regulations do supersede HIPAA with more stringent breach notification rules that may include also notification to state attorney generals or state departments of legal affairs, even credit agency notifications, and even credit monitoring services. So it's really important to know which regulations and notifications are required for your state. So some examples where the state attorney general needs to be notified is like Alabama, California, Florida, Hawaii. And then there's some examples to notice the credit reporting agencies also include Alabama, but also Florida, Minnesota. So it's really important to know what your state specific breach notifications are. And please keep in mind, so there is also the latest breach notification requirement. On March 15th of 2022, the president signed into law a significant new federal data breach reporting legislation that could vastly expand data breach notice requirements far beyond regulated entities or entities processing personal data. And that would require notification to the cyber incident reporting for critical infrastructure within 72 hours of a breach, of a discovered breach. And so with that, I will pass it back over to Toby to go over a little bit more about audits and such.
Thanks, Courtney. So OCR audits, right? Breaches are a constant threat. We've seen, while the actual number of breaches has not dramatically spiked over the last couple of years, it's fairly leveled off, and we're still looking at about almost 2,200 data breaches over the last 3 years. Cyber criminals are getting more savvy. There's no sign that they're going to slow down their attacks. So at some point, there's potential for an audit. And the Office of Civil Rights, DOJ, state attorney generals, as Courtney mentioned, are the enforcement authorities. OCR audits, OCR is really the auditing entity, though. And we should probably talk about what triggers an audit. So it could be a number of things. I'm going to talk about what almost never happens, and that's a random audit. OCR simply doesn't have the resources to do random audits as much as they would like to. So it's highly unlikely that you're going to get a call completely out of the blue from the OCR saying, hey, you're going to be audited. But right of access has been a big factor in audits over the last 12 months. And a lot of that's because people don't simply understand the regulations that exist also at the state level, as Courtney mentioned, that are there to protect the patient's rights. So if you get a breach, it's almost certain that you're going to get audited. And one of the things they're going to want to ask about is when was the last time you did a privacy risk assessment, and making sure that you're understanding that your staff is trained and things like that. So how can we help you with that? Well, there's good news. We actually do offer a privacy risk assessment. So it helps you maintain, but really the goals of it is not only just to be compliant with the HIPAA federal regulations, but depending on where you live, where you practice, again, there may be stringent state policies and regulations that supersede those federal regulations. So the policies and procedures show your intent. It provides workflow guidance. Training, as Courtney mentioned, is a very critical element, making sure that your organization's processes are understood and helps reduce the amount of breaches, because knowledge is power. And covered entities and business associates. The business associates agreement is often a forgotten one here as well. This includes folks like your copier repair people. If you swap out a machine, they got to make sure that it's wiped before it goes elsewhere because they store data. So making sure that the business associates are assisting covered entities, and the BAAs are a big factor in spelling that out for you. So how we do this is we take you through a very simple 3-step process. It's very much like a TurboTax tax-like approach, where we're going to run you through a reflexive question engine, really just kind of a wizard, interview you, to ask questions about your privacy, about your physical location. Then we work on planning remediation. So we're using citations in specific frameworks like NIST, HIPAA, HITAC, state-specific laws, 42 CFR Part 2. And then finally, we prepare a report and action plan that helps you understand what your risk is, and then offer remediation services if needed. So with that, we've got about 2 minutes left. Sierra, I don't know if there's time for questions, probably not. But if anybody submit a question, we certainly will be more than happy to follow up with you after the call. And if you would like us to follow up with you to give you a little bit more information about our services, please feel free to click on the poll question here. Otherwise, we thank you for your time. Courtney, thank you for your expertise as always. And unless there's anything else, thank you for your time and wish you good luck the rest of the day.